Good evening. Thank you so much for joining me for another pharmacology class. Last day we had dealt about vinca alkaloids. Today we will be continuing with the cytotoxic drug and we will be going through the taxane group. Taxane group, it consists of two drugs, paclitaxel and docetaxel. Let's start off with paclitaxel. Paclitaxel is a complex diterpene taxane which is obtained from the bark of western yew tree. It carries out its cytotoxic action. And here it's not going to inhibit any polymerization, or it's not going to stop the polymerization from taking place, but it's going to favor polymerization, but it's going to be quite different from vinca alkaloids. So the mechanism of action when compared to vinca alkaloids, it is totally different. It's just the opposite that takes place over here. Now what it does is it's going to enhance polymerization of tubulin. Now, like yesterday I said, this microtubular agents, or the microtubular proteins which are present, they are responsible for the polymerization to take place and the cell division continues. So here this will be enhancing the polymerization of tubulin, and these macrotubules, they will be stabilizing. It undergoes a lot of stabilization which results in inhibition of normal dynamic reorganization of microtubule network, which is very essential for vital interphase and mitotic function. Okay, so here this particular microtubules, or this particular reorganization continues. Okay, and what happens is there will be abnormal, or there will be a large number of microtubules which will be present, and this will be resulting in abnormal cell division. Okay, so abnormal arrays or bundles will be produced during this cell cycle. So here the things are not going to be in the normal way. Okay, and the cytotoxic action of paclitaxel emphasizes the importance of tubulin and microtubule dynamic equilibrium. This equilibrium has to be broken. It has to be continued for a normal cell division, or for the cell divisions to keep on going in an abnormal way. But once this particular action takes place by, or carries out by, this paclitaxel, okay, this particular microtubules, they are not going to be organized. They are going to be disorganized, or there will be more number of abnormal arrays or bundles being produced. So we can say that in each phase, or the phases will be getting interrupted. There are each phase in a cell division. So in the cell division, the phases will be getting interrupted, and as a result, this particular cancer will start getting inhibited, or the cancer cell formation will be getting inhibited. Okay, so what are the indications? Indications will be in case of metastatic ovarian and breast cancers. After a failure of first-line chemotherapy takes place, this provides a good hope for the particular treatment. And apart from that, advanced head and neck carcinomas, small cell lung cancers, and esophageal cancers, adenocarcinoma, and in case of hormonal refractory prostate cancers. So for this particular areas, we have this paclitaxel being in good use. Now let's talk about the toxicity. Now here the toxicity can be reversed back is the myelosuppression and stocking and glove neuropathy. Now what do we mean by stocking and glove neuropathy? Now stocking and glove neuropathy means initially the patient starts complaining of tingling sensations, there will be numbness, there will be unusual sensations, weakness, burning pain, which will be taking place in the affected areas. And which are those affected areas? The areas where we will be putting the gloves and the stockings. So these areas will be they will be showing out these particular signs. So glove and stocking neuropathy means the patient will start complaining of tingling, numbness, abnormal sensations, weakness, and they will be experiencing burning pain. Okay, so the areas where we apply the gloves and the stockings, this particular area, they will be getting involved in this particular neuropathy. And apart from that, the troublesome problems you can notice is chest pain, arthralgia, myalgia, mucositis, and edema. These can become troublesome if we are not careful. Now, the dose. The dose we go for applying is 175 mg per meter square by intravenous infusions. Here we'll be going for infusions and over a period of 3 hours, which will be repeated every 3 weeks. So this is about paclitaxel. Okay, so both docetaxel and paclitaxel will be working out or carrying out its cytotoxic actions. So it will be so paclitaxel, it is basically complex diterpene taxane, which is obtained from the bark of a western yew tree, and it carries out its cytotoxic action by enhancing the polymerization of the tubulin, and these microtubules get stabilized, which results in inhibition of normal dynamic reorganization of microtubule network. In each phase of the cell division, these microtubules have to get arranged in a specified manner. But here there will be abnormal bundle or arrays of microtubules in each phase. As a result, the cell division will not be taking place in the normal way as expected. So this is how they're going to arrest the cell division. And the indications are in case of metastatic ovarian breast cancers after the first line chemotherapy has been failed, and even if it shows a relapse also, we can go for treating this. And apart from that, we can use it in case of advanced head and neck carcinomas, in case of small cell lung carcinoma, in case of esophageal adenocarcinoma, and in case of hormone refractory prostate cancer. And the toxicity is reversible myelosuppression and glove and stocking neuropathy. And the troublesome problems that we have to consider if it happens or we need to check out for is edema, then chest pain, arthralgia, myalgia, mucositis. These have to be checked out. And the dose is 175 mg per meter square by intravenous infusions over 3 hours, and this has to be repeated every 3 weeks. Moving over to docetaxel. Docetaxel is actually a congener of paclitaxel. They also follow a same mechanism of action, and it has been found even more effective in case of breast and ovarian cancer refractory to the first line drugs. Small cell lung cancer, pancreatic, gastric, head and neck carcinomas, they are the other indications. And major toxicity is neutropenia. In the first case, paclitaxel, it was myelosuppression and glove and stocking neuropathy. But here, the main important toxicity we can find is neutropenia, but this neuropathy is very less frequent. And apart from that, we need to report to the doctors if we notice arrhythmias, sudden fall in their blood pressure, and heart failure occurs. So in these areas, we have to immediately notify the physician or the doctors who are treating them. And the dose is 100 mg per meter square intravenous over 1 hour, and we could repeat this particular after 3 weeks. So this is all about the taxane groups. Okay, so in taxane groups we have paclitaxel and docetaxel. So docetaxel is actually a congener of paclitaxel. It follows the same mechanism of action, that is, it carries out the cytotoxic drug, and they will be enhancing the polymerization of the tubulin, which is a protein, and due to which the microtubules undergo stabilization, resulting in inhibition of normal dynamic reorganization of microtubule network, which is a very important for interphase as well as in the mitotic functions. And there will be production of abnormal arrays or bundles of microtubules which will be produced in the cell cycle. And indications are metastatic ovarian and breast cancers after the failure of first-line chemotherapy, as well as in the relapse cases. And even we can find that it is very useful in case of advanced head and neck carcinomas, small cell lung cancers, esophageal adenocarcinomas, and in case of hormone refractory prostate cancer. And the dose is 175 mg per meter square by infusions intravenously, and it will be administered for over 3 hours, and which can be repeated after 3 weeks. The toxicity we can find is reversible myelosuppression as well as glove and stocking neuropathy. And glove and stocking neuropathy, we have to inform the patient to report if they are experiencing any tingling sensation, numbness, and if they are experiencing certain abnormal sensations and weakness and burning pain over the areas where we apply gloves and stockings, we have to immediately notify the physician too. Moving over to docetaxel. Docetaxel is a congener of paclitaxel, but it is said to be even more potent when compared to paclitaxel, and it also carries out the same mechanism of action, and it is even more effective in case of breast and ovarian cancers refractory to the first-line drugs, small cell cancer of lung, pancreatic, gastric, and head and neck carcinomas are the other indications. Here the major toxicity is neutropenia. The neuropathy is very less frequent, and report to the doctor if the patient starts complaining of or if the patient is shown with signs of arrhythmias, sudden decrease in blood pressure and chest pain, and even heart failure. We have to immediately notify the doctor. And the dose we administer is 100 mg per meter square over 1 hour intravenously, and it could be repeated after 3 weeks or at 3 weeks. So with this, I have covered the topic of taxanes. Moving over to the next group, EPIPODOPHYLLOTOXINS. EPIPODOPHYLLOTOXINS. And here we just have only one drug, etoposide. So it's actually a semi-synthetic derivative of podophyllotocin, which is a plant glycoside. Semi-synthetic derivative of podophyllotocin, which is a plant glycoside. So it is not a mitotic inhibitor. It's not going to inhibit the mitosis, but it's going to arrest the cells entering into the G2 phase and causes DNA breaks by affecting the DNA topoisomerase 2 function. DNA topoisomerase 2 is an enzyme. Okay, so it's going to inhibit the functions which are carried out by this particular enzyme. So while the cleaving of double-stranded DNA is not interfered, okay, the DNA will be forming a double strand, but usually when the bond between the nucleotides is not very strong, it does not enable the DNA strand to be double-stranded. Okay, so here the double-stranded cleaving of the double-stranded DNA is not getting interfered. The subsequent resealing of the strand is prevented, and it is mainly used in case of testicular tumors, lung cancers, Hodgkin's, and other lymphomas, carcinoma of bladder. In these areas, we go for using this particular drug. Alopecia, leukopenia, and gastrointestinal tract disturbances are the main toxicity. The dose that we go for administering is 50 to 100 milligrams per meter square per day intravenously or oral for 5 days. So that's about epipodophyllotocin. So epipodophyllotocin consists of adipocyte, which is a semi-synthetic derivative of a plant glycoside called as a podophyllotocin. And it's not a mitotic inhibitor, but definitely it's going to arrest the cells when it enters into the G2 phase. And it causes DNA breaks by affecting the DNA, the enzyme that is the DNA topoisomerase 2. And while the cleaving of the double-stranded DNA is not interfered, the subsequent resealing of the strand is prevented. It is mainly used for testicular tumors, lung cancer, Hodgkin's, and other lymphomas, and even carcinoma of the bladder. Alopecia, leukopenia, and gastrointestinal tract disturbances are the reported toxicity we could find in this particular drug. And the dose we administer is 50 to 100 milligrams per meter square per day intravenously or as an oral administration for 5 days. Thank you so much for joining me. In this class, I had completed the 2 classifications under cytotoxic drug, that is taxane group and the epipodophyllotocin group. I hope you have understood. Thank you so much for sparing your time. Have a good time. Thank you.